Hello again everyone, I am Dr. Shweta Jain and today I am here to talk to you about myopia, also known as nearsightedness or short-sightedness. Myopia is the most common cause of impaired vision in people under the age of 40. In recent years, its prevalence is growing at an alarming rate. It is an eye ailment which makes it difficult for people to see objects at distance. If you are nearsighted, you will have difficulty reading road signs and seeing distant objects clearly, but will be able to see well for close-up tasks such as reading and computer use. With the tremendous amount of time we spend in front of screens, it is but natural that our eyes get affected. With everyone stuck at their homes because of the pandemic, working from home, studying online, it's almost like screens are our consistent companions, which explains why myopia is on the rise, and it is the most common eye refractive error in both children and adults. In this video, we'll be discussing about myopia, its symptoms, causes, treatment, how to control it, and lastly, degenerative myopia. Let's get started then, shall we? Symptoms of myopia: difficulty reading and seeing distant objects clearly, squinting your eyes to see better, regular headaches due to eye strain, and blurred vision. Symptoms of myopia vary between person to person. Short-sightedness usually starts during the school years and get worse over time until the eye is fully grown. Myopia can also be inherited and may run in the family. By looking out for certain signs, you can identify myopia in children, such as noticing how they may sit close to the TV or asked to sit at the front of the class so that they can see the whiteboard. Children may also rub their eyes regularly or complain about headache. It is important to be cautious about the early signs and symptoms because there are cases where myopia gets progressively worse and the only possible fix or last resort becomes surgery. Let us now find out what causes myopia. Causes of myopia. Myopia usually occurs when the shape of the eyeball is too long, which can cause the rays of the light to focus in front of the retina instead of on it. Myopia can also be caused due to unusual curvature of the cornea or the eye itself. Stress-related myopia is usually seen in people whose job involve long hours of nearsighted activities, which cause muscle spasm due to prolonged stress on the muscle. Now that we know what causes myopia, let's see what we can do to fix it and help you see better. People with myopia have quite a few options to treat nearsightedness. Here's a few of them. First, glasses. People with myopia can get prescription glasses. They are probably the most conventional fix for myopia. They are also simple and relatively pocket friendly. However, glasses can be a little uncomfortable for some. They interfere with your peripheral vision and are not always a great choice for high endurance tasks which involves a lot of movement. Good choice for eyeglass lenses for nearsightedness include high index lenses for thinner, lighter glasses and lenses with anti-reflective coating. You can also consider photochromatic lenses to protect your eyes from UV rays and high energy blue light and to reduce the need for a separate pair of prescription sunglasses. If you are nearsighted, the first number on your eyeglass prescription or the contact lens prescription will be preceded by a minus sign. The higher the number, the more nearsighted you are. Second, contact lenses. Contact lenses are designed for people who require a wider field of view or are into physical work or sports, which is quite difficult with glasses. Lenses can come in handy for someone who is looking for a fix for myopia vision without wearing a traditional pair of glasses. However, maintaining your contact lenses can sometimes be a hassle. You need to be very consistent with your lens hygiene because lenses are worn directly over the naked eye and make you more susceptible to infection and allergies when compared to glasses. CRT or ortho-K. Corneal refractive therapy, also known as ortho-K, is a non-surgical procedure which involves wearing a set of rigid contact lenses which eventually correct the curvature of the cornea and fix the vision. With pressure, the lenses fix the curvature so that the light entering the eye is focused at the retina. These lenses are generally worn overnight only to see the world better during the day with the naked eyes. When you remove the lenses in the morning, your cornea temporarily retains the new shape so that you can see clearly during the day without glasses or contact lens. Fourth, laser surgery, also known as LASIK or PRK. The laser reshapes the cornea and permanently cures your myopia. Fifth, ICL or RLE, implantable Collamer lens and refractive lens exchange. These are the surgeries done in cases where LASIK is contraindicated. So, can myopia progression be controlled or stopped? With more people becoming nearsighted, there is a lot of interest in finding ways to control the progression of myopia in childhood. A number of different techniques have been tried, including fitting children with bifocals, progressive lenses, and gas-permeable contact lenses. All of these have delivered mixed results and still are being researched. Recent studies show that low-dose atropine eye drops could slow myopia progression in school-age children, with significantly fewer side effects compared with the higher concentrations. Some kids, though, don't respond well to atropine eye drops. Last, let's talk about degenerative myopia. In most cases, nearsightedness is a minor inconvenience and poses little or no risk to the health of eye. But sometimes myopia can be so progressive and severe, it is considered a degenerative condition. Degenerative myopia, also called as malignant or pathological myopia, is a relatively rare condition. In malignant myopia, the elongation of the eyeball can occur rapidly, leading to a quick and severe progression of the myopia and even loss of vision. People with this condition have a significantly increased risk of retinal detachment and other degenerative changes in the back of the eye, such as bleeding in the eye from abnormal blood vessel growth. Degenerative myopia may also increase the risk of cataract. So, if you are having trouble reading signboards or distant far-off objects, you should get an appointment with your ophthalmologist. I hope this video was able to give you good knowledge about myopia. If the video was informative, do hit the like button and subscribe to get more such updates. Thank you.